This is a part 4 video of the rapid revision head and neck. Here the important spotters are, here you have the gland, this is the parotid gland. From the parotid gland there is a duct going into the mouth, so it is called as parotid duct. So parotid duct, where does it drain? It comes from the anterior border of the gland and it drains into the vestibule of the mouth, opposite to the crown of the upper second molar tooth. That is the answer, proper answer for the parotid duct. Above that you have the upper buccal branch, and below you will be having the lower buccal branch, and here is the masseter muscle, the nerve supply, nerve to masseter, and origin insertion, read and come. And if you see here, you have the digastric bellies. Okay, anterior belly of digastric, nerve supplies by, see, look at this, anterior belly of digastric, nerve supply, nerve to mylohyoid, and posterior belly of digastric is at the back, it is supplied by the facial nerve, and beneath that you have the very important nerve, your, can you see, hypoglossal nerve, very important spotter, hypoglossal nerve. It lies on the hyoglossus muscle and supplies the muscles of the tongue, except palatoglossus, which is supplied by the pharyngeal plexus. And then, sorry, palatoglossus, which is supplied by the cranial root of accessory. And the next one, facial artery, facial vein, already we have seen. And this is the parotid gland apex, apex is down in the carotid triangle or digastric triangle, and the base is on the external acoustic meatus. Here only you have the superficial temporal artery and auriculotemporal nerve are coming, and the retromandibular vein formation is coming on the apex, and anterior border you have the parotid duct emerges out, and facial nerve 5 branches are emerging out, and posteriorly you have two surfaces, posteromedial and anteromedial. Anteromedial, it is related to the masseter, medial pterygoid muscle, and the angle of the mandible, and the posteromedial is related to the styloid process and the structures related to the styloid process. And this is how you have to simply, you should explain in the exam. Okay, parotid. So this is very simple, base above near the external acoustic meatus and the temporomandibular joint, and this one artery and auriculotemporal nerve, and the apex near the posterior belly of digastric and related to the retromandibular vein and platysma, and the superficial surface or lateral surface, skin superficial fascia, and parotidomasseteric fascia, which lies above, that is parotid capsule. So you have to talk about that. The deep lamina only forms the stylomandibular ligament, that is very important, we expect this. So skin, superficial fascia, everyone will tell. The deep fascia will be divided into superficial part and deep part. Superficial part will go above the parotid gland and forms a parotid capsule and attached to the zygomatic process. Deep part only that forms the stylomandibular ligament. So keep it in mind, which divides the parotid gland from the submandibular salivary gland. And then structures inside the parotid gland is facial nerve and retromandibular vein formation, and deeply you have the external carotid artery. It divides into terminal branches after entering into the parotid gland only. So posteriorly the external carotid artery enters and the facial nerve enters. Anteriorly parotid gland emerges out and the facial nerve emerges out. This is how you have to tell in the exam. And then secretomotor pathway of the parotid gland is very important. And then sternocleidomastoid mustard, already I told. And then these are the dural folds. Dural folds usually we keep, see, look at this, this is the fox cerebri. Look at this, fox cerebri, it's the sinus is related to that, you will ask. And this is the tentorium cerebelli, will ask the free margin and attached margin, and the sinus is related to the tentorium cerebelli, will ask. This one is the tentorium cerebelli. Can you see this one? Okay, the next one is fox cerebelli. This is cerebelli, which is down. You can see, no, this is above for the cerebrum, this is for the cerebelli. Here you have the fox cerebelli, this area. This is for the cerebellum hemispheres. Here you have the occipital sinus, where the fox tentorium cerebelli, here is the area you have the straight sinus, where the fox meets the tentorium. This area is for the straight sinus, and this is for the occipital sinus. And diaphragma cellae, which covers the pituitary fossa. That's diaphragma cellae. So this is about the important spotters here. And the sinus is related to the fox cerebri are superior sagittal sinus, inferior sagittal sinus, and where it is attached, there you have the straight sinus. And then pin of the ear, this is the, if there is a put the pin over here, that is called pin of the ear. Pin of the ear, we will ask the nerve supply. You have to write the lateral surface, medial surface, and upper portion and lower portion, like that you have to divide the nerve supply. And here is the frontalis muscle, nerve supply will ask, and buccinator already I told you, and facial artery, facial vein over, and parotid duct over, and the very important muscle masseter, and the temporal is very important, that will be asked. And here also I showed the structures, two nerves. Definitely we will keep two nerves inside this infratemporal fossa. The medial nerve is your lingual nerve, the lateral one is here. Both the things are cut. The previous video I showed the both the nerves, very important spotters, and only one artery we will keep inside, that is your maxillary artery, that also we showed in the last part, and this and all we have seen.